individuals who were sleep deprived have had lower responses of T cells, some different aspects of T cells, one of which is a natural killer cell, which helps with viruses and immediate interaction with the infection to try to kill it and, recruit other aspects of your immune system to further kill the pathogen or whatever the bad bug is, so to speak. And what that in turn says, if you're sleep deprived, you have lower potentially T cells, you might be at a higher risk of having infections or having your body take longer to ward off the infection. Common symptoms of sleep apnea, number one is snoring. Loud disruptive snoring, you're getting the elbow from your bed partner to flip over, or they're leaving the room from you, just to try to get away from you. That's number one, a large symptom, loud disruptive snoring. Certainly if there's somebody that tells you that you're choking and gasping and you're actually stopping breathing while sleeping, that's another one. That's a big sign of obstructive sleep apnea. Other symptoms, daytime sleepiness, you're falling asleep behind the wheel, heaven forbid, but that would be very bad. Ultimately, needing more caffeine to keep yourself awake to fight off that daytime sleepiness. Another symptom is unrefreshing sleep. When you're waking up, and let's say you've allowed yourself 8 hours of sleep, but you wake up and felt like you're hit by a truck, you barely slept at all. That's another feature, just waking up being unrefreshed. Waking up frequently during the nighttime for whatever reason. One of those reasons might be to use the restroom. That's been another feature that can be suggestive of an underlying obstructive sleep apnea.
How serious is sleep apnea?
Oh, obstructive sleep apnea is a very serious condition. In terms of the epidemiology studies that we know, believe it or not, 80% of the population has probably not yet been diagnosed. And so there's a large amount of people that are out there that really just need to look at their sleep, talk with it about their physician, and look at it. It's been found to cause a lot of other issues down the road. It has a lot of, in terms of inflammatory markers, obstructive sleep apnea causes more of these pro-inflammatory markers, which in turn can increase your risk of having heart attacks and strokes because of atherosclerotic plaques that can develop. It can cause a lot of other issues as well. Cardiac arrhythmias, so it's been pretty well related to having irregular heart rates and rhythms, especially atrial fibrillation is one. Ultimately diabetes as well. It's been shown to cause higher risks of having glucose tolerance problems or insulin insensitivity issues as well. Certainly obesity as well, because your sleep while sleeping, if you're not breathing appropriately, it's a very interrupted aspect with a lot of other issues that occur with your nervous system, more inflammation that happens, etc.